Well, do you think we need a tax on sugar? A quarter of Australian children and two-thirds of adults are overweight. And there's been an increase in type 2 diabetes. That's why a new parliamentary report has recommended a tax on sugar-sweetened drinks and a ban on marketing and advertising for junk food to children, particularly online. One of the authors of the report is Dr. Sophie Scamps, who is the independent member for Mackellar and a GP. Good morning and welcome, Sophie.
Good morning. Thank you.
Thank you. So, what drinks would be hit with a sugar tax and how would it work?
Yes, so we're calling it a reformulation levy because the aim is really to get these companies to reduce the amount of sugar in their drinks. So that's what's happening overseas. It's driving this reformulation so that they're slightly healthier and have less sugar in them. So any drinks, any water-based drinks that are non-alcoholic that have added sugar in them. And it would be a tiered approach as well, a graded approach. So companies can reduce the amount of sugar, and that's what's happened overseas, and get under that tax threshold.
I see. So we're going right back to the source here, to the manufacturers of sugary drinks.
Exactly. It's all about creating healthier environments for our population and our children to thrive in, because at the moment we're just bombarded with marketing of unhealthy food products and drinks all the time, online, on TV, on radio, and it's really hard to get away from it. And what's happening, children in their bedrooms, when they're online, information is being collected about them, they're having labels attached to them, and then they're being targeted with particular advertising. So as parents, we don't even see what they're seeing because it's online. So that really needs to be regulated. That sort of unfettered targeting of our children with unhealthy food products really needs to be looked at and restrained.
So can we just talk about which drinks would be hit with a sugar tax?
Well, any water-based drink, non-alcoholic, that has sugar added to it. So it would be anything from soft drinks through to fruit juices that have added sugar in them.
Right. And so the tax is a sort of sliding scale according to the amount of sugar in the drink?
Yes, that's correct. So
I see.
From what I understand, the drinks with the highest level of sugar would increase in cost by about 60 cents per litre. But as I said, what's happening overseas is when these reformulation levies are brought in, what it does is it drives the companies to change the amount of sugar that's in their products so that they are slightly healthier for people. So people are not getting those huge amounts of sugar with every drink that they have.
I should point out that not all the committee members agreed on a sugar tax. The coalition MP said the cost of living is already too high. Would it increase the cost of drinks, Sophie?
So, look, it is slightly controversial, I would say. It's been something that's been sort of talked about for a very long while now, but it really is about trying to create an environment for our children and for people to live in that is healthy, so that people have the best opportunity to have a healthy life. So with cost of living, what it would do is, as I said, like hopefully what will happen is the companies will reformulate their products so that actually their products will not be more expensive. So in the long run, it's not more expensive for people to buy these drinks. But also when you think about it, it really is driving this avalanche of diabetes. And for a person who's living with diabetes or has a child with diabetes, there's a massive cost impost that comes with that, with all the doctor's visits, the medications, and then longer term, the complications that come with that. So as an individual, you may be paying thousands of dollars for your health costs. So when you weigh up having healthier products with that healthcare impost that comes with diabetes, then really I think it's a no-brainer in many ways.
Yes, listener Adrian has texted, the Conservative government in the UK introduced a sugar tax and the companies simply modified their recipes. I don't understand why those companies don't just use the same recipes here without needing to pay the tax. Is it a problem for them to do so? It's an interesting comment.
Well, that's exactly right. Why don't they have the healthier products here in Australia? And that's what we need. We need to implement the same policies so that we drive them to do that here in Australia as well, because the companies aren't doing it voluntarily. So we do need to have a signal for them to go in that direction. And like I said, it's already happened overseas. So it's very easily they could introduce those recipes here as well.
Yes. In some places, a can of Coke is cheaper than a bottle of water. Would a sugar tax change that?
Well, that's the major problem. We went out to remote Indigenous communities where even just getting fresh water is a real difficulty. And so for people out there, it is cheaper to buy a slab of Coke than get fresh water. So that is something that also needs to be addressed by government. This is not just a one fixed solution. We
Mm.
need an all of government solution to this. All sectors, multidisciplinary. There's many things. So the reformulation levy is just one pillar of what needs to be done, and it does need to be all of government. But I would say that diabetes and obesity is now a public health emergency. It's like a larger problem than even smoking was. So we do need to act on this. We do need to do something, and we've just sort of given the multinational junk food companies free rein to target our children, so that they're targeting them with harmful products. We do need to act because we have a duty of care to look after the population and particularly our children.
Mm. Sophie, a couple of listeners are suggesting on the text line, will companies just replace natural sugar with chemical sweeteners, with additives, sugar-free additives, which I think have proven to be not that healthy either?
Well, we're looking at obesity and diabetes, and sugar is what is driving those issues there. So, although many people wouldn't choose to have drinks with artificial sweeteners, it is a healthier option if you're thinking about obesity and diabetes in that regard.
So far, the proposed sugar tax is just on drinks. Should it be broadened to other products, chocolates, lollies?
Well, I think one of the other things, so that's why it's a multi-pronged approach. So also looking at this, the marketing side of things as well. So we do, as you know, we just see junk food advertising everywhere, and so that also has to be looked at as well. So I think it has to be a graded approach. As you said, it's slightly controversial that there'll be a reformulation levy on sugar sweetened beverages. So it is a stepwise process. This is what we saw with public health steps in tackling smoking rates as well. So I think you start with the levy on sugar sweetened drinks, and then look at marketing, but also look at education, look at physical activity, look at the environments we're building for people to live in. There has to be an all of government approach to this, and then we keep going.
Yes. We're speaking at the moment with Dr. Sophie Scamps. She's the independent member for Mackellar. You were part of the push to rename the alcoholic drink from hard solo to hard rated, weren't you, Sophie? There's a large ad along Parramatta Road that actually my producer Pat saw this week. He reckons the can looks exactly the same.
Oh, well, actually, no, I wasn't part of that push, but one of my colleagues on the crossbench, Kylie Tink, was. Yes, so yes, I haven't looked closely at what's happened with the packaging on that product.
All right, he's not very happy.
Good.
And so the sugar tax and junk food ad restrictions, they're just recommendations at this point, is that right? Has the government expressed interest in implementing them?
They are recommendations at this point, but the government has also done research into what it would mean to have greater restrictions around junk food marketing, and that is something that I introduced as a private member's bill as well, and will be having those discussions with government about trying to get that over the line. But it is something, there does need to be a conversation around this. But when you look at the challenge that we face with diabetes and with obesity in this day and age, we do need to act. It is, the smoking challenge of the day. It is a public health emergency. And I think for government not to act, it would be an abrogation of that duty of care to the population. What's happening is more and more people are getting diabetes. They're getting gestational diabetes. If you have diabetes when you're pregnant, it does actually change the genetics that you're passing on to your child as well. So your child is far more likely to have both birth defects, but also get diabetes themselves and a far more aggressive form of diabetes. So you then have your child. Every parent wants their child to have the best life that they can. So it is a way that we need to act now, because we are harming our children through not acting.
There are a lot of comments on the text line, I have to say, Sophie, about it'll just be replaced by these artificial sweeteners, which you have said don't contribute to, diabetes. But as a doctor, what is the effect of artificial sweeteners on one's health?
Well, I think there needs to be further research on what is actually the impact. But I do agree. I wouldn't be choosing to have artificial sweeteners myself. But I think if you're looking at the epidemic that we have of diabetes in Australia, we have 1.5 million people with diabetes. The vast majority have type 2 diabetes. There's probably another 500,000 who are undiagnosed. The major challenge that we have at the moment is type 2 diabetes and obesity, and it's sugar that is driving that at this stage. So that's a massive public health issue that we do have to respond to. And hopefully just reducing the sugar content is something that can happen. It doesn't automatically mean that they'll be replaced with artificial sweeteners.
Yeah, okay, fair enough. And just to politics, Sophie, your fellow independent, Monique Ryan, has asked the Prime Minister to call an early election. Are you ready to head to the polls?
Yes, she has. I think. Look, it would be nice in a way to get it over and done with, but I don't think that there'll be a snap election anytime in the next couple of months. That's for sure.
All right. Good to talk to you. Appreciate your time. Thank you very much.
Thanks so much.
All the best. Bye-bye now. That is Dr. Sophie